Hi there, welcome back to All Things Home Care. I'm your host, Dana Arnone, and I'm here with a longtime friend of mine, Dr. Rosario Accardi, who is a so you're a doctor of physical therapy.
Correct, yes.
So is that like a normal thing now? I don't know, I get stuck on that.
Now it is. I would say about 6-7 years ago, it wasn't as well known as it is now. Now I think all major colleges have a doctorate program when it comes to physical therapy.
So what's the difference, though, if you're a doctor of physical therapy?
There really is no difference, I guess. It was a master's program initially. First it was initially a bachelor's program. Then they stepped it up to a master's program. Then they stepped it up now to a doctorate program.
So you should have been ahead of your time.
Yeah, I was actually one
little
of the
smarty
first years.
pants.
Yeah.
So I'm sorry, I just got off topic. I don't know why, because I saw it on there, so I just said doctor. So we go. We were just sitting here talking about. We go way back, and we shared an office space together before we both started our businesses. And it's funny how in the span of 10 years, how people grow.
Yes.
Both in their personal lives, their business and stuff. So we shared a very small office space, and now you're doing very well in your practice. You're doing home physical therapy.
Correct. Yes.
So everything you do is in a person's home?
That is correct. Yes.
Do you go into assisted livings at all?
We can. Do we know? But we can, yes.
Okay, so your business, I want to get it straight because I know what it is, but I know I'm going to mess up the word. So it's At-Home Active Motion Physical Therapy. That is a tongue twister.
Perfect.
So I'm going to say it again. At-Home Active Motion Physical Therapy.
AMPT.
Okay, good.
Abbreviations
okay.
makes it a lot easier.
So you are what they call a Medicare, a Part B provider.
Correct, yes.
Versus a certified home care company, which is a Medicare Part A provider.
Yes.
So for people that are watching right now that don't know the difference between the two, just give them a little bit of background on what makes a Part B provider a little bit different than somebody that works through a CHA.
Sure. Well, Part A is usually utilized when a client is in the hospital. That's on the Part A services. Part B services, just imagine going to an outpatient facility, except we're going into the client's home instead. That's a utilization of Part B services.
So why would someone use Part B versus A? Like a CHA, certified home care agency, versus someone like your company?
Well, they would need to be hospitalized first in order then to get into a short-term rehab facility, and then they'd be able to use the Part A services because they would be sent home with a certified home care agency to utilize that Part A.
More of the skill?
More of a skilled need, for example, nursing, PT, OT, speech, as well as a home health aide as well. Whereas we, as Medicare Part B providers, only provide the physical therapy aspect of it.
Do you provide OT?
We do provide occupational therapy on certain areas. It's area-driven, more or less. Jamaica, Queens, more of the Queens border between Queens and Nassau border.
So where is it that you service? What areas are you servicing?
We service Nassau, Suffolk. For physical therapy, we service Nassau County, Suffolk County, Brooklyn, as well as Queens.
Oh, it's big.
Yeah.
So, and you have about how many therapists that work for you?
We have about 21 therapists.
Because I remember when I first met you, it was just you.
Yes, that is correct, yes.
So you've grown.
We've grown a little bit, yes.
Very good.
Yes.
That's very, I think that's wonderful. So for physical therapy, we were talking about this before. I personally, I'm a registered nurse, but I been in home care most of my career. And I don't think people realize how physical therapy can make or break someone staying at home. So one of the things that we focus on a lot is minimizing hospitalizations or rehospitalizations. One of the ways that we do it here is that we have a case management program. And what we do is every time a registered nurse goes to the home, whether it be for a beginning of care with somebody, or if they're going for the 6-month recertification, or if there's a change in status, we're always filling out this case management form. And mostly it's because of physical therapy. I want to know, for me as a business owner and for my clients and my patients, how are they doing in the home? Do they have mobility issues? Is there safety issues? So let's talk a little bit about physical therapy in the home and what can somebody expect from physical therapy.
Sure.
Because I think it's really what's going to make or break, that's going to determine whether someone is going to be there's other factors, of course, but physical therapy is huge. So let's talk about home safety.
Sure. So what happens initially is we get a referral, a script from the doctor. We go in and we do an initial evaluation. When we do the initial evaluation, we also do a home assessment as well. We want to make sure that they have every type of equipment that's necessary. For example, grab bars to transfer in and out of the tub more safely, promoting good usage of the assisted device. They may be using a rollator or a standard cane, but now they have to use a rollator instead of a standard cane because of a loss of balance. So we want to make sure that the home is safety-free. As safe as possible.
Right. Let me ask you a question. So, because one of the most common questions that I get here when people are calling up, they'll be like, I need grab bars. Can someone have physical therapy just for grab bars? No.
No,
Okay.
this is just, those are just different types of equipment that we as physical therapists recommend. And then they would have to follow up with their doctor to get a prescription for that particular type of equipment, in which then the doctor, I guess, would send it out to a durable medical equipment company. We just make the recommendation. Our primary goal is to be proactive rather than reactive. We would want to make sure that they do not fall in the house. And any measure taken would be to minimize that risk.
So in physical therapy, I would, because I was a child nurse for a very long time, and everybody would expect you guys to come with weights on your back and a treadmill. So what equipment does a home physical therapy utilize versus what they would see in an outpatient program?
In an outpatient facility, there's a lot of machines there. You have bench press machines, you have leg press machines, leg extensions, dumbbells, and so forth. My therapists go into the home with cuff weights that go up to about 5 to 10 pounds, TheraBands, which vary depending on the color of the band, a lower bike ergometer, which is just a small little bike that you can use for the upper
pedals,
extremities.
yeah.
Yep, you can use it for the upper extremities as well as the lower extremities as well. Sphygmomanometer, blood pressure cuffs, and so forth. But we like to utilize the equipment that they have in the house. For example, everything is ADL driven, making sure that they're able to go up and down the steps, making sure that they're able to get in and out of the tub.
Okay, people may not know what ADL means.
Oh, I'm sorry, my apologies. ADL is activities of daily living.
Right. So the normal things that everybody does every day.
Correct.
Yeah.
Yes.
Walking upstairs, getting in and out of the bathtub, up and down off the toilet, in and out of the bed, which is a huge problem.
That is correct.
So those are the things that you focus on.
Yes.
Yeah. See, when I was in, the chart, or I was seeing people in a nursing home, and they were coming home, and they would want to go to outpatient, I'd be like, but you don't understand. You got to first learn how to deal with your injury or the situation in the home.
Correct.
So going up the stairs, that's 10, 12 steps.
That's one of the biggest goals for us as physical therapists, is trying to get them up and down the steps as independent as possible, so then they can go onto an outpatient facility and receive the physical therapy there.
Is that what normally happens? Is they
Yes.
get, and
So-
you may recommend outpatient therapy?
Yes,
places?
once we feel as though that they've maxed their potential as far as home care physical therapy is concerned, and they've plateaued, then we would then send them or make a recommendation to an outpatient facility nearby.
Now, one of the things that I've experienced with the difference between Part B and a certified home care company is the time frame, the length of stay of a therapist under Part B versus a certified home care. So I know in certified home care, 2 weeks usually, we're done, we're out, we've gotten you where you needed to go, then we move on. But Part B seems to be able to stay in a little bit longer.
It's condition driven, really.
Yeah.
It really all depends on the
Maintenance.
patient's condition. With certain types of insurance, such as Medicare, they don't actually cover maintenance therapy.
Okay.
It's more of a skilled restorative need, so the medical necessity has to be there in order for us to go in and do the physical therapy.
But what's your normal length of stay?
Like I said, it varies. It can be as short as 3-4 weeks or as long as 6 to 8 weeks. It really all depends on the client's condition and ailment and how well they're progressing with the physical therapy.
And you let them know when you're going to discharge
Correct.
them?
We
You're
always
gonna
let
say
them know
you're
a week or
preparing
2
them?
weeks ahead of time, stating that mom or dad has plateaued with her physical therapy, or her physical therapy is coming to an end. We feel as though that she would benefit from an outpatient facility, or she would benefit from just continuing doing the home exercise program that's originally given to them upon initial evaluation with the aid.
So do you see a lot of companies in your experience, sending therapists in to see their patients in the home? Like, where's most of your referrals coming from, I guess is my question.
A lot of it is coming from doctor
Doctors,
offices, nurse practitioners, social workers, family members, the community as well. We have a good name in the community as well.
And we were talking about before, a lot of the managed Medicaid programs now are really focusing on the limiting rehospitalizations, because when the patient is rehospitalized, they're not making money, the home care's not making money, the patient's not where they want to be home. So I know that I get told a lot, minimize rehospitalization. And so for me, physical therapy is one of the ways to do it. You work with a lot of the managed cares as well.
Correct, yes.
Which ones do you work with?
Age Well, Elder Serve, Integra, and a few other ones as well.
Do they refer directly to you?
Correct, yes, they do.
What are they, that's pretty good. What are they asking you to do?
Well, for example, we may have a client that had a sub-post recent fall. So they would want us to go in just to assess the patient, make sure that they are at top functional level, or if they need any type of equipment to minimize that risk for fall. Why did they fall? what their current status is, as well as a 6-month certification period as well.
Oh, they do. Very good. Okay. So, and the doctors, if they have somebody that's coming into their practice that seems a little off, their gait's a little off or wobbly or whatever, they will refer directly to your office?
Correct, yes.
So just give everybody the phone number. So if people are out there listening that they say, oh, you know what, my dad, my mom, my sister, whomever, may benefit from physical therapy, or there's a question, can they call up and say?
They can call us anytime.
And they could just say, hey, listen, I got a loved one at home. What do you think about this?
We get calls all the time stating whether or not mom or dad is a good candidate for physical therapy. We go over different types of ailments, a little checkoff list to see whether or not they would benefit from physical therapy or not. The phone number is 866-605-5634.
And that's for anywhere, where people live anywhere?
Nassau, Suffolk, Brooklyn, and Queens,
Okay.
correct.
Well, when you said someone calls up to say if they are candidates, so who's your ideal candidate for home physical therapy?
It varies. If, let's say, for example, Jane will make up a client. We'll say Jane had a recent fall, and she's had multiple falls now, and she keeps falling. That would be a good candidate. History of falls. She may have a gait abnormality, gait meaning walking. She may have difficulty walking. She may have muscle weakness. Her legs may be, one leg may be weaker than the other, hence her right knee may buckle when she's walking. Or she may not be utilizing the assistive equipment such as a rolling walker properly. So that would be a good candidate. History of falls, difficulty walking, muscle weakness, CVA, post-CVA. Total hip replacement, total knee replacement. So those are just different
basically
array.
anybody.
Yeah, basically anybody that is having a hard time getting out of the house, transferring in and out of a chair, or difficulty standing up, difficulty getting in and out of the bed. Those are different ailments.
You know, actually, you just said something. So I know for certified home care, they have to be technically deemed homebound.
Correct.
Is it the same thing for you guys?
That is correct, yes.
So they can't be going to the mall and receive home physical
No,
therapy.
somebody who's trying to train for a marathon
Yes.
shouldn't be getting
They're
home
not
care.
a good candidate.
No, they're not.
They could try, though.
They can try,
And
but
they
they're
might
not a
want
good-
personal training. That might be a new business for you,
There
Rosario.
There you go.
could do personal
That's
training and
right.
getting rid of
Another new niche now. There you go.
But so the homebound.
Correct.
So if you see somebody in the mall doing leaps and tracking, they're
would be a
not
good candidate.
Okay, good to know. So I had another question. So as far as keeping people safe in the home, just if people are out there, what are some simple things they could do?
We have a checkoff list they would like to go through. We can even go through the checklist over the phone when they call, making sure that large objects of furniture, such as a couch, isn't smack in the middle of the living room, because they may have a tendency, mom and dad, get up in the middle of the night and bump into it and bruise and fall. Making sure the electric cords are pushed to the side, not exposed. Making sure that the tiles are in good condition. The rugs are in good condition as well. There's no rips or tears in the rugs or the tiles. Because as we age, our walking, our gait, I should say, we start having a tendency to not lift our feet as high, and we start dragging our feet. So if the tile is cracked or chipped, we may catch our forefoot on that tile and trip over. So you want to make sure that the floor is in good condition as well.
Yeah, those are simple things that people
very simple.
Yeah, that can prevent a whole slew of problems.
Correct, yes.
Right there. That's because when we get that question a lot, can you come do a home safety evaluation of the house? And I'm like, well, I'm not a physical therapist.
That would be
but-
done by a physical therapist upon initial evaluation
Yeah.
for physical therapy.
So your primary insurance that you accept is Medicare.
Correct, yes.
No managed Medicare.
No managed Medicare, straight Medicare.
Straight Medicare. And then the managed cares, but they would make the referral to you if it was a Medicaid client that has
Yes.
aged well. You would get that referral from the MLTCs directly.
Directly.
Okay. And then and there's a private pay component too?
We do have a private pay component to it as well.
So if they
could-
want to know those rates, they can give you a call?
Yes.
Okay. Very good. So your office is where? You're in...
We're located off of South
You
Service
stayed
Road
in Jericho.
In Jericho. We're literally right around the corner.
Okay,
We're in
very
Jericho.
good. All right. And so once again, just so everybody out there listening, if they want to get in touch with you guys just to see if you can do an evaluation for the home or just to talk about what services you guys offer, what's the phone number?
866-605-5634.
Do you have a website that they can visit?
Yes, it's www.activemotionrehab.com.
Okay. So if anybody has a question, you can always call here and speak to myself. The number here is 516-308-4840. I can find Rosario for you. If not, then you can find him at, let me see if I can, oh my gosh. Back when we knew each other, I could read this. 866-605-5634?
Correct.
Okay, very good. Okay, or you can visit us at our website, which is reliancehssny.com. We could definitely give you a link over to Rosario. Thank you.
Thank you
so
for
much.
having me very much. I
I
appreciate
hope
it.
that people understand the importance of home physical therapy and how it really can maintain your longevity in the home. Very good. Thank you.
Thank you.
Bye. Hi there, it's me again, Dana Arnone from All Things Home Care. Just wanted to remind everybody to find us on Facebook, iTunes, or Google Play. Follow our podcast. Let me know what you think. If you have any suggestions of information that maybe you'd like to hear, or it's something that you can have some help with, or some guest that you might like to see on the podcast, or maybe you yourself want to be on our podcast, we'd love to have you. So give us a call here, 516-308-4840. Visit us on our website, reliancehssny.com. You can talk to me through the website. Please let us know what you're thinking.